Hello, my name is Brooke Newport, and I am the manager of the Small Animal Image-Guided Radiotherapy Shared Resource. The directors of the shared resource are Dr. Sana Karam and Dave Westerly. And we are currently located in the Vivarium in Research 1 North in room 437. So as the name suggests, we specialize in image-guided radiotherapy for small animals, specifically mice. And the reason that we do this is to sort of be able to deliver radiotherapy in a way that is more precise and accurate, and also has better translatability to clinical results and consequences. In addition, using image guidance to irradiate mice also helps avoid toxicity to normal tissue, as opposed to radiation that uses single source and lead blocking. So the real benefit of using image-guided radiotherapy is to be able to deliver radiation to a very specific area while avoiding the areas that you don't want irradiated. And this is more similar to the way that this treatment is delivered in clinic. So this is our irradiator. We have a XRAD Smart Plus irradiator from Precision X-Ray. The features of it are that it has a built-in anesthesia system, so that we can deliver isoflurane anesthesia while the mice are in the machine, so we don't need to worry about any other types of anesthesia. The irradiation itself is very precise because there's both a 360-degree rotatable gantry and a moving stage, so we can radiate from any angle and can move the stage so that the mouse can be positioned in various ways. In addition, we can also irradiate areas as small as 0.5 centimeter diameter area with accuracy up to, or down to, I guess, 1 millimeter. And the maximum dose rate we are able to deliver with this machine is 6 gray per minute, which is fairly high. So we are able to, this makes it more feasible to irradiate mice for larger studies. So because this is an image-guided irradiator, it also has several imaging capabilities, and the first of those is fluoroscopy, which is basically just X-ray imaging. So with this machine, in addition to irradiation, we are also able to produce X-ray images for monitoring or for use with targeting for radiation prior to treatment. The other imaging modality that is possible with the XRAD Smart is cone beam CT. So again, because this is an X-ray machine, there is the rotatable gantry. We are able to capture CT images of mice, which can then be reconstructed to get 3D images such as the one over here on the right. And these images can be very helpful, again, for monitoring or investigation of certain areas or tumors that might need closer investigation. Another service that we're able to do with these CTs from the XRAD Smart is treatment planning. So what's shown here is treatment planning for lymph node irradiation. As you can see here, we have 2 beams that are targeted to these lymph nodes, sort of in the mouse's like armpit area. And we were able to sort of simulate the doses from these 2 beams, and the dose volume histogram for those can be generated as well, so that we can assure that we're getting the correct dose to these structures. And so with these two imaging modalities, we have two image-guided irradiation options. The first and most common one is fluoroscopy guided. With this one, we use the fluoroscopy to first target the area for irradiation and collimate it, and then deliver the treatment to the mice. And so the benefits of this treatment are that it is faster, and we can still target the necessary area using fluoroscopy to ensure that we hit the right target every time and don't irradiate as much normal tissue. The other option is CBCT guided irradiation, which utilizes our treatment planning software. This irradiation is highly accurate as we use the treatment planning software to generate a treatment plan on site right before irradiating the mouse. So we are able to program into the irradiation software the treatment plan so that after we've contoured the tumor and set up the beams and confirm the dose distribution, we can deliver very accurate irradiation to just that structure. And again, as little normal tissue as possible. And so I'm going to go into some examples of these next, of some of the services that we provide. So one of our most popular forms of imaging is this CBCT lung imaging. So we have a bed that allows for up to 3 mice to be imaged at a time with the cone beam CT. And this service is very useful if you are interested in monitoring lung tumors or for finding lung mets for other tumor studies. The next service that I'll talk about is the fluoroscopy guided brain irradiation. So this is how we use the fluoroscopy to sort of look at the mice prior to irradiation and target the required area. So what's sort of shown in the image here is a fluoroscopy image of a mouse with the area that we've collimated to and irradiated shown in red. And this will be the treatment for cerebellum irradiation, but we are also capable of irradiating other brain structures or areas for tumor treatment, such as the pons or the thalamus. And the most recent one that we've been working on is CBCT guided lung irradiation. Without the CT guidance, this would be very difficult because we aren't really able to see lung mets on fluoroscopy. And so being able to use the CBCTs from the X-Ray Smart allows us to specifically target these lung mets and deliver as much radiation to those as possible, while also avoiding more of the lung to avoid the toxicity that can be associated with irradiating the lung and other surrounding tissues. And so just as a summary for the services that we generally provide, the X-Ray Smart is capable of both imaging and irradiation. Based on those images, the imaging modalities we are capable of are fluoroscopy or X-ray imaging and cone beam CT. We can irradiate using either of those imaging modalities to guide the irradiation, fluoroscopy guided and CBCT guided. And in addition to that, I can also perform analysis or image export of the images that were captured during irradiation or CBCT images that were captured for longitudinal monitoring studies. In addition, for new types of treatment or tumor areas, I can also create new treatment plans for irradiation using our treatment planning software. Or of course, I can also help you with study design for the irradiation portion of your research. So thank you so much for listening to my presentation. Our website is shown below. And again, we are located in RC1 North. And feel free to reach out to me with any questions. Thanks again. And I'm happy to take any questions, of course. The image analysis software that we're using, so for analyzing CT images, we generally use a software called ITK Snap, which is it's free to use, but it's capable of doing threshold-based segmentation for these CT images, which is what was shown in the previous slide, or of course just viewing CT images.